Hi everybody, this is Cindy and I'm going to make a little video here to show you an example of what I'm looking for in the presentation for the plan change process. And so I'm going to use the sample that I put on Moodle and that we talked about in class, and that's Jessica. You remember my client Jessica, who is a 28-year-old woman who has finished medical school. She's a resident and she's doing very well, but she is just so overwhelmed and finding herself quite depressed and anxious, and even has had thoughts of suicide. So she's decided to seek some help. She has a history of depression in her family, so she's worried about that. This has all impacted her work, and so that impacts the way she feels about herself. And it also has put a strain on her marriage, and her husband wants to help, but she's kind of just pushed him away, and yet she talks to her friend, but not so much him. So here's what I would have you do. So that's a capsule. That's just enough of what you need to say about the client, because we will all be able to read your whole full page description of them earlier before we hear you talk. So now I'm going to talk about the assets and the deficits. So let's do the assets first. Jessica's very bright, intelligent. She's doing very well in her studies to become a physician. Very demanding, so I have to give her credit for so much, but she's still feeling overwhelmed with it. She has quite a great career ahead of her. There's no reason to think she won't finish and do well in the career she's chosen. She has friends who care about her. She has a husband who's very supportive and is trying to do everything he can, but he's feeling kind of frustrated right now. She has a strong sense of morality. She really wants to do the right thing, help people, and that's what she's devoting her career to. Very motivated, financially stable. She doesn't have to worry about that. So she's got a lot going for her, but in terms of the deficits and the problems, she has probably, we're thinking, depression, at least situational depression because of being overwhelmed. It may also be genetic, and so we would want to check that out in our assessment. She's not dealing with this very well. She's just kind of pushing on rather than dealing with things, and that's getting her more and more fatigued and isolated from her husband. She's not sleeping, and she's tired, and she's anxious. She's even had these thoughts of suicide that I mentioned already. So those are the problems, and the deficits are actually going to be addressed in some ways by the strengths that she has, or the strengths that she's going to acquire through some of the interventions that we do. So before we talk about the theories, I want to talk about the perspectives that we use. So of course, always have used the strengths perspective with every client, and in this case she has many of them, and that will give us something to build on. And she's not going to have a hard time seeing that she has strengths. She knows that she does. And then we will use the person and environment perspective, where we're looking at how the fit between the environment and the client works. And right now the fit isn't too good because all the energy is going out, not in. And if you did an eco map, for example, you would see that. Also, we're going to use an ecosystems perspective or ecological perspective, because we're going to be looking at how she and her social environment interact and how that becomes a cycle sometimes. So in terms of the theories, we'll talk about the orienting theories that we would use. Because she blames herself for all this and feels she should be doing better, she ought to be able to handle this. I'm using the attribution theory. And because she has the possibility of inheriting depression from her father, we're going to be using the medical model to try to understand that. Also, it might be called the genetic model of mental illness. Looking at cognitive theory too, cognitive development, she's very high in cognitive development, very bright, very capable, but hasn't been able to figure out some problem-solving skills and coping skills for herself, so we'll work on that. In terms of the cycle of change theory, she is in the determination stage, which means she wants help. She hasn't yet found a way to put it into action, so she's not quite in the action phase, but it's a good thing where she is. In terms of her moral development, Kohlberg or Gilligan's moral models both would say that she's high on morality. She's trying to do the right thing even when it kind of takes a toll on her. And then in socialization theory, we're thinking maybe that she has been socialized through school and maybe through her family to be a hard worker, because she definitely has a hard and strong work ethic. And the socialization in medical school and when you're a resident is really something. You're just expected to tough this out. And so she's been exposed to that. It's going to impact her. It'd be hard for her to admit that this is a struggle. Now, what are we going to do for practice model? What are we going to use in our interventions, actually? So we're always going to use a client-centered therapy for voluntary clients because it's her life and she gets to decide if she's going to do anything and how she's going to do it and when. So that's first of all. Now, second, we're going to use the crisis intervention model because we are going to jump into action when we hear her talk about suicide. We're going to ask her more about that. We're going to do an assessment and see if she needs to get some help right away or if it's just fleeting thoughts of suicide that she's had. We're also going to use an empowerment model. We're going to get her to see that she does have control over her life because she really does, even though she doesn't think that she does. And every little bit of power she gains will help her gain more. We'll use the medical model of treatment because we may advise her to get medications, prescription meds for her depression. We'll use motivational interviewing to help her see that she has many choices and that it's all up to her. We're not going to push her, help her find the motivation from within in order to keep going, and this would be using motivational interviewing. A final thing I think I would use is solution-focused therapy, which is actually two things, solution-focused therapy and narrative therapy. Solution-focused because when people do feel overwhelmed, if you have solutions in mind for specific problems you've identified, then when you address those and you deal with something like time management or sitting down and talking to her husband or considering medications, those real tasks, and something changes for the better, that makes you feel like you have more power. So it's a good thing to use. And then if she agrees to counseling, I think I would use a narrative therapy approach because I think she can rewrite her life, whether that's in real writing or if it's just in the way that she thinks about herself. So either one of those would work. So she is a pretty motivated client, and I think we're going to do well with her. Thanks.